we're excited to go over kind of this career deep dive session 1 on healthcare technology, digital health and healthcare data analytics. I do want to just introduce our speaker, Michelle Voorhies. She's the AVP of Consumer Products at Ascension Health. She also has a lot of experience at the Mayo Clinic, and I will let her just talk about herself briefly, and then we'll go through just a few overview questions and dive into it.
Good. Thanks, Parker. Nice to meet all of you. So I'm Michelle Voorhies. I'm the Associate Vice President of Product Management for Ascension Health. I just started that job 3 weeks ago. So I'm tired. I've been doing a lot of learning this week. And before that, I was the Vice Chair of Digital Products for the Mayo Clinic. Very similar job, just in a different organization. But what that means is I work with patients and clinicians to understand what needs they have, and then I partner with my team and engineers and designers and data scientists and all sorts of other technology professionals to build digital solutions to solve their problems. So if a physician tells me that he spends 30 minutes a day writing up notes about his patients, I might say, 30 minutes is a little too long, and he might say that too, and we'll develop digital technology to help those things go faster, or something for patients as well. I've been a digital product manager for 25 years. I've done it in a number of industries, healthcare now, but previously I worked in financial services and retail and hospitality, all for brands that you probably would have heard of, Marriott, Gap, those types of things. So I've been doing product management for as long as I can remember. It's what I started doing right when I came out of undergrad, and have just stayed in that career field. So I can answer a lot of questions about that, and I can kind of answer questions about the kind of data science and that side of the house too. I'm an MBA student as well right now, so I actually sit in this exact classroom every Monday night for 4 hours listening to professors, and Brad, Dr. Stats that you guys had earlier, I'm taking his class in the fall, so I haven't started that one yet, so we'll see. So I can relate to what you guys are going through too. I'd love to, as we're going through this, I just kind of want to get a feel for who's in the audience. Can you guys indicate, if are you an undergrad, can you raise your hand? Okay, and the rest of you are MBA? Yeah, MBA. Anything else?
MHA.
Okay, cool, awesome. And you guys are together, the MHA, right? All right, awesome, great. Great to understand who you guys are. So yeah, I think Parker's going to ask me some questions, and I'll answer them, and then we're going to do a case study.
Yep. Yeah, just a couple questions. You kind of already told us about yourself and a little bit about your career journey, but would love to hear from your perspective about kind of how do you view healthcare technology and digital health in this day and age from your perspective. How important is it, and where does it live within healthcare and the whole healthcare system?
Sure. So obviously, since I chose to go into this career path, I think it's really important. So technology is moving so quickly. It always is moving quickly, but we're on kind of a huge hockey stick ramp up right now with the introduction of agentic AI and those types of things. But healthcare is honestly a little bit behind in leveraging technology. So the other industries that I've worked in have been further along, and it's for lots of really good reasons. Healthcare is cautious, so have to be cautious. Things have to be researched. They have to be proven. Clinicians are, is anybody a doctor or a clinician in the room? You got one, okay. So clinicians are difficult to convince to try new things. They want everything to be proven, and there are laws and policies and regulations that are important. So I'd say technology is lagging a little bit in a healthcare perspective, but it's having a moment right now from my point of view. I've only been in healthcare for 4-ish years, so I've got a really tiny view of it. But what we're starting to see is it's being introduced in every kind of moment of the journey. So from you sit down and you might have a headache and you research on a digital platform to try to figure out what's wrong with you. You want to book a doctor's appointment. You're probably doing that online now as opposed to picking up the phone and calling an office, which is what I would have done when I was you guys' age. And then you show up to the office and the clinician is typing on a computer into your electronic health record, something that didn't really even exist 40 years ago. And from there, you continue to have technology in your healthcare journey. I I was talking with my mom earlier today, and she was telling me about an experience that she had while she was actually in the hospital. They didn't have the type of doctor that she needed in the hospital she was in. And they just turned the TV on at the back of the room, and there was the doctor, and she was like, completely amazed. And those are the kinds of things that that my teams build. They bring in the doctor into a community that might not have access to the type of specialists that you need. So I feel like technology is everywhere in healthcare right now, and it's just going to continue to ramp up over time, and that's going to help all of us be healthier people in the long run.
Great, thanks. And then just like, what does day in your life look like in your current role, or if you want to talk about the Mayo Clinic and kind of what you were doing there, like common skills you're using that you think people here could potentially learn and utilize, as well as I'd honestly be interested to hear about how you juggle that plus like doing an MBA as well. You've got a lot going on.
Sure. All right, day in the life. As a product manager, I spend my entire day sitting in meetings, to be very honest with you. Like I sit and I work remotely, so I sit in an office in my house, a little 12 by 12 room with my computer in front of me and talk to people all day long. So if you want to sit at a desk, product management is probably something to consider. Very much kind of an office type job. But there are a lot of other aspects that are fun and exciting. I get to do a lot of research, so I get to get out in the field and kind of experience clinical locations. I get to shadow physicians and sometimes patients if they're willing to have someone kind of follow them around. Have the opportunity to kind of walk in their shoes a little bit to try to understand what's hard about what they're doing, hard about their kind of medical experience. Had an amazing experience at Mayo Clinic where I got to shadow a world-renowned, I have a really hard time with these big words, but basically a cancer surgeon. Got to watch him remove tumors from people. So just kind of watching his process and watching how he, what did he have to do to prepare to go into the surgical suite? What did he have to do in the surgical suite? Now they all have these huge monitors all around them with pictures of the tumor that he's removing and information about the patient. So, I get to do that kind of stuff sometimes too, which is really fun. But other parts of my day-to-day, all these meetings that I'm in are, with folks that do design of the ideas that we're pulling together. So I meet with what we call user experience designers and graphic designers and copywriters and those types of jobs where, those people are actually physically designing out the products that we might build. I spend a lot of time with our engineering staff and our architects, who are people that have undergraduate and master's degrees in computer science and those types of things, because they're actually going to code a lot of the products that we're building. And then, like I said, I get to spend time with our clinicians as well. So they're really my customer. So understanding what they need is important. How do I balance school and getting and working? I also have a 13-year-old daughter, so there's another thing in there too. Yeah, it's hard. Going to school and working full-time and having a kid is challenging, but you guys know that going to school is challenging, and I'm sure they're talking to you about time management and how do you kind of block out your day and how do you prioritize. And I probably shouldn't say this to a room full of students, but I will anyways. As an MBA student, it's kind of, I'm going to pass or I'm not going to pass. So I try to keep that in the back of my mind, and nobody's ever going to ask me what my GPA was because I don't have one. So, I put in as much. I have in my mind that I'm putting in what I get out of it is what I put into it, and some of the classes I know I'm not going to be really applying to my day-to-day life, so I might put a little less in. Shouldn't admit that, right?
That's very fair, thank you. And then just moving into the case study, I'll probably let you take this as you came up with this and this is kind of your expertise here. So if you want to just kind of walk us through the scenario, and then we can go through what people will be working on.
Sounds good. So what we're going to do as an activity, I'm going to ask you guys to get into small groups with your neighbors and have some conversation for about 15 minutes. And we'll kind of walk you through what we hope you'll talk about. But this is the scenario. And this is my day-to-day life. So this scenario is what my team is charged with as we're trying to think about how to provide access to healthcare and solve some of the healthcare crises that are happening in the world right now. So I work for Ascension Health now, which is very different than my previous employer. So I'll just give you guys a little bit of background and some details from the case. So Mayo Clinic is what is a serious and complex destination health provider. So the job of the Mayo Clinic is for people who can't get care at home. They can't solve the problem that they have. Their disease is so serious. They often travel to where the Mayo Clinic is. There's 3 locations. They see a clinician. It's kind of a moment in time. Now I work for a community health organization. So, like you go down the road and you go to the hospital, probably here, UNC or that other one that we don't talk about. You might go to get healthcare in that scenario. So Ascension is a community health. We have 120 locations, mostly in the Midwest, but some of them on the East Coast as well. And our charter as a Catholic-driven healthcare organization is to provide care for all. So we're going into communities where people might not have access to care. We're building hospitals in places where people might struggle. They might drive 45 minutes just to have a primary care appointment. So very different kind of approach to healthcare. And in my current world, the problem that's on the screen in front of you is very real. So healthcare is going through a shortage. People don't want to become doctors and nurses anymore. It's very hard. There's a lot of strain on your mental health. The educational requirement is very challenging. Sounds like we have someone in the room that might be familiar with some of those things. It's tough. And even sitting in my MBA program, there are a number of physicians in my evening MBA program who have decided they don't want to practice medicine any longer. They want to move on to do something different. Maybe they're going to support healthcare from a business side of the house, but it's hard. So there's a stat that I found online, and I've seen lots of these, but this one was I think we're going to have a shortfall of about 100,000 physicians in this country by 2034. That means that people won't be able to go see the doctor. I feel it even here in this community where there are tons of access to healthcare. I was trying to get a dermatologist appointment recently, 6 months. I was like, what? 6 months? And then it wasn't an emergency. So I was like, all right, 6 months. I guess that's how long I'm waiting. But that could be very serious if something really was wrong with you. We also have a challenge with kind of the financial structure of hospitals. Many of the ones in rural communities are closing. So that access is getting even harder. And they can't make their operating expenses balance out appropriately. So lots of the things that you guys are learning about in school, they just can't make it work. They can't make enough money. The insurance companies aren't paying them at the high enough rate. So again, access is getting smaller and smaller. And then finally, our population is aging. Everybody knows what baby boomers are. So we have people are getting older. By 2030, we think about 25% of our population will be over 65. As you get older, you need more healthcare. So these things colliding into each other, it's kind of the perfect storm. Less people want to be doctors, more people are going to be sick. What do we do? So people like folks in the roles that I'm in, we're thinking about this problem and we're trying to think about how do we use technology, data, business, how do we solve for these things? So that's the activity I'm going to ask you guys to do. So we're going to ask you to get in a group. I had no idea how many people would be in the room, so I said 3 to 5. Just form a little group, whatever, however many people you're comfortable talking with. Would love for you to think a little bit about a type of healthcare professional in the digital or data or technology space that maybe you could be. I think you all got some pre-reads that had 180 different types of professions, but the few that I listed out up here, what I do, digital product management, so somebody who tries to find a problem and solve it with technology. Data scientists, so people that are digging into the numbers, understanding kind of the impact of things, building out models to help you do something different in the healthcare space, automating those types of things. And then I threw out a health tech startup because that's fun and sexy. So you could start a company that builds a medical device or an app or something like that to solve for the problem. So spend a little bit of time kind of talking about the variety of careers that exist when you think about technology and in healthcare. Pick one, and then describe a potential solution that you could build using technology or data to this problem of less doctors, more sick people. What are we going to do about it? So come up with an idea, and then spend a little bit of time talking about well, if you were to actually do that, what steps might you need to take from where you are today in your undergraduate or MBA programs in order to take yourself into that space. We're going to give you about 15 minutes, so you're not writing a paper or anything, you're just having a conversation. And then we're going to ask a few of you to kind of share with the group, and then we'll do some question and answer about the ideas that you came up with, as well as just working in technology and healthcare. I hope you guys had some good conversation in your groups. Thank you for doing a little case study. So would love to have maybe 2 or 3 of you. We've got about 15 minutes, so just share, what did you guys discuss? What did you come up with? Yeah. Brave, go ahead.
So our group decided that there'd have to be kind of a combination of approaches, that, perhaps one subset would need to look at the data side, either through building an application or some other methodology of identifying areas that are hurting the most through either closure of hospitals or just more rural communities. And then combining that information with policy change from a state level to incentivize doctors or people who are being trained, who are still in school, to get either partial or full loan payment coverage from the state, as long as they do a rotation or some sort of coverage in these lower or these impacted areas.
Right. So take the business and policy side of things to try to kind of stimulate and provide more supply than solve on the other side. That's great. Awesome.
One thing that we kind of ran into was like the boomer population and a digital solution don't really meet very well in the middle sometimes. So it's like, how do you get old people to get good at technology? It's really, hey, promote a wearable with a long battery charge. Because I give my grandma an Apple Watch, she'll forget to charge it within 48 hours, and there goes all the health data. And then also just things like empower education with like CNAs, because there's a lot more of those. Teach them how to do more of the stuff that provider might do. Because, provider, you're just analyzing data at that point. So that was pretty much.
You bring up a great point around the kind of aging population and access to technology and comfort in technology, and we struggle with that in more lower socioeconomic communities as well, with maybe not as much access in that space. And one of the things that is top of mind for me and my peers in our current job is not only is it challenging to get technology adopted, but then often when you're in a healthcare moment, you're also in an extremely high stress moment as well. So how do we introduce something that might make you uncomfortable in a normal day in a moment where you're feeling like anxiety and those types of things? It's definitely a top of mind thought and something that we deal with on a regular basis.
So as we discussed, the boomer population and the technology don't go hand in hand. So our solution was more towards the root cause, that is, there will be more Gen Zs or Gen X who will be doctors. And how do we promote them to take up this profession and reduce their workload, doing less of administrative work or doing more of the intricate surgery? So we planned on getting the more robotics arm, making the surgical suite more tech driven than giving the entire load on the doctors and the practitioners.
I think introducing those technical tools that make clinicians' jobs easier, whether it's robotics or other tools and whatnot, is definitely something that large health systems are thinking about regularly, because people are interested in it. Like it's kind of like an incentive. I'm one of the first people that did this kind of surgery through robotics and whatnot. But it also helps, and it has positive health outcomes as well. So we're starting to see that introducing some of these tools results in less time to recovery, less infection rate, those types of things. So it's exciting to see that stuff as well. Anybody else want to share? Go ahead.
Hi. Our group was brainstorming on multiple ideas. I'll just talk about 2. One was addressing the doctor-physician shortage aspect, where we think that a big deterrent for getting into med school is the cost. So if medical tuition costs could be reduced by reducing the med school physical infrastructure, the hospitals have to be there for rotations, but maybe reducing costs on classrooms and switching to digital methods, virtual classrooms could be one way. The second thing was more to reduce the need for doctor visits in person in cases of follow-ups, for example, after a knee replacement, when a physiotherapist or an orthopedician needs to follow up on the progress with exercises. For example, the leg has to be able to move, a range of motion has to be checked. So there are devices now even within a mobile phone that can check that. So leveraging apps like that, and say for wound healing after a burn, follow-up using an image analysis app. So those kinds of products would help decrease the need for in-person visits for physicians.
It's a huge area of focus. So I used to work with a woman who was a thoracic surgeon. Told you guys I have a hard time with these big words. And she actually developed an application for to follow her patients after surgery. She partnered with an engineering firm. She uses it with her patients. She's done research studies in that space, and exactly what you were saying, that it reduces the need for follow-up visit, which allows her to be accessible to more patients, and it also has positive health outcomes. She's written a number of papers around leveraging these tools and the opportunity to help more patients and the opportunity to have people have higher survival rates post surgery, which is huge. It's really impactful to people's lives. So it's a great idea. Anybody else want to share?
Oh yeah, just one thing that I just thought about, also for physician burnout, since also to tackle the problems of the shortage of healthcare providers, but physician burnout is obviously one of the biggest causing factors. And one thing that I was thinking about, like especially for those patient portals that physicians need to spend a lot of time on, probably we can. Except for policy parts, we need some probably data evidence to inform the policymakers, and also we probably can combine some, let's say, technical support like digital assistant for the patient portal. So that could probably, improve the efficiency of our healthcare providers dealing with the patient portals, and so that's maybe also that can not only can improve the satisfaction among patients, but also release their physicians' burnout outcomes. I think that would be
So there's an organization called EPIC. Some of you may have heard of them. They introduced. They basically own the electronic health record at this point, and they had their user conference this past week, and they announced the introduction of Emma. She's their artificial intelligence that will lay on top of my chart, which you guys probably log into when you go see your physicians and whatnot. And there was another, I think it was Emma and Alex, I can't remember. One is patient facing and one is clinician facing, and basically doing what you're describing. So summarizing the health record for the physician, trying to introduce some efficiency into the process. I will say that there's excitement, right? Obviously the industry is excited about it, but there's also that kind of clinician nervousness. Does this AI, they feel that when they read the record, they're going to notice something that, the AI might not notice. So how do we kind of build that trust within the clinical staff? And also, how do we deal with the inherent biases in those artificial intelligences that are summarizing things? We've got a lot of data that shows that it kind of perpetuates bias that might exist within the world. So how do we make sure but biggest, EHR company in the world is doing what you're describing. So it's great. Go ahead.
I'm not from the US. I moved here from Canada, and something that we do really well is leverage allied healthcare professionals. And in our group, another thing that came up was, what are some other allied healthcare professionals that can fill in some of the care gaps for people who don't have immediate access to their GP in rural communities where clinics are closing? So we're talking like respiratory therapists, nutritionists, physical therapists, and maybe from a public health perspective, investing more on the prevention side and like the health education, health literacy through digital health platforms will also prevent people from even needing to go to a clinic or an ED, whatever the case may be. And maybe an example, like if an elderly patient has COPD and they have good quality time, whether that's virtually with a respiratory therapist,
they know how to use their inhalers, they know how to use their medications, they're not getting exacerbations, they're not ending up in the ED. So, in addition to like increasing the scope of what the CNAs do, I think even just increasing the variety of medical professionals can help fill some of those gaps.
For sure, it's a big initiative within the organization I'm in now, is trying to figure out how do we get the information in the hands of the patient to avoid the need for, usage of advanced clinical staff, and how do we create a way for folks like you're talking about, like allied health professionals, to work at the top of their license and provide the input that the patients need, and avoid all of that coming to the emergency room and coming to, I saw the craziest stat the other day about emergency room as the entry point to our health system. I'm not gonna get it right, but, and the way it kind of shows up and the differences for underinsured or uninsured people, which we won't get into the differences of the US and other countries there, but we have a lot to learn from other places, so. All right, I think I have like 2 minutes, so I'm gonna turn it over to you guys to ask any other questions that you might have. Go ahead.
I have 2 questions. First is, how much coding do you need to do in your role or be familiar with as you work with coders? And then the second is, why are you deciding to go for an MBA at this stage?
So I have never coded anything in my life. I had a blog 10 years ago and did a little bit of HTML, but I don't code as part of my job. Many of my peers have engineering backgrounds, so that's kind of another path to come into product management, but I've never coded. It's changing right now because of the introduction of all the AI tools that will allow for people that don't have technical backgrounds to develop code. So I'm seeing in some of the more junior product managers in our teams, lots of them are starting to do that. So I would say I have not found that you need an understanding of coding and development to be a strong product manager, but lots of people have that background. So, you don't have to learn how to do that. I understand it well enough to talk about it, I just don't actually code. Why did I get an MBA right now? I've been talking about getting an MBA for 20 years, and my husband and I sat down and had a conversation, and he basically, I won't say the word, but blank or get off the pot was the conversation. He was like, you're either gonna do this, this is the last chance. Do it now or forget about it, kind of thing. So I needed that little kick in the butt. At the time, I was working for Mayo Clinic, which is an organization, it's an academic health center, so a lot of value is put on advanced degree in that organization, which was a little kick in the butt too. But and I live in Chapel Hill, and living in a place with a great program like this, access to it. And I also just kind of had this little I live here, but I really don't have a strong connection to this university for any reason. Why not get one? So, those were the reasons. Go ahead.
I'm just curious to understand, what is the most coolest product that you have worked on during your sprint in digital health?
Coolest product I've worked on. Okay, so flashy cool. My team launched a product at Mayo Clinic Jacksonville, which is one of our locations, where they introduced these enormous televisions and video cameras into the inpatient rooms. So, and they're these TVs are half kind of digital whiteboard, half video kind of. They're 105 inches, they're enormous. So you walk in the room and you're just whoa, this thing is crazy. And they display all their health information on it. But the part so it's flashy, it gets people to donate money to the hospital, it's cool. But it has an embedded camera in it that is monitoring, and the team built models to predict fall prevention and I forget what it's called, inpatient dementia. It's a condition that happens to people when they're in the hospital and whatnot. So they're able to monitor the patient through these, the video cameras and tell something's going to happen to a patient, which reduces the need for, allows you to have a lower ratio between nurses and allied health professional staff. So I thought it was pretty cool. And I took pictures of it because it was really neat looking. So go ahead.
What is one thing that Mayo is focusing on or is bullish on in terms of adoption of AI, one particular aspect?
Yeah, so Mayo Clinic is very bullish in the AI space. So it recently brought on a chief artificial intelligence officer, a gentleman who was working for, I can't remember, some government agency. His name's Mickey Tripathi. He's like amazing. And the focus there is really across the board. So artificial intelligence on the administrative side of the house, from an operational perspective, artificial intelligence introduced into things like building predictive models, looking into kind of genomics and those types of things to try to help us get ahead of healthcare issues. A huge push in the radiology space, so reading kind of the output of your tests and whatnot. It's pretty much everywhere. But what I will say is also taking a very serious responsibility in the side of ensuring that you don't roll out AI where it shouldn't be. So Mayo is engaged in a number of organizations. There's actually one that's kind of kicked off here in partnership with Duke Health, has an AI division as well, to make sure that the policies and regulations and all of those things are in place as well and lower the risk of introducing artificial intelligence. So they take it really seriously. The organization I'm with now is kind of just starting to get into that space and following the lead of folks like Mayo.
Wrap us up.
My question is, in your experience, how big is that hurdle of regulatory problems with the digital health space?
It's big. There's a lot in that space. You have getting a device approved through the FDA and whatnot can take a very, very long time. So yeah, it's definitely plays a serious role all the way from kind of that approval of devices into things that might not even be top of mind. So my current team is focused on applications and web platforms, and we can't introduce technology that other industries could introduce, like tagging and tracking and those types of things, because of the risk of people's health data being exposed through those things. So it's a constant conversation. Awesome. Well, thank you guys. This was really great. Can I have to take a picture with you all in the background? Are you okay if I do that? Because I have to show my classmates that I taught this class.
I'm gonna steal that idea.
We'll put it on LinkedIn and yeah.
Marketing collateral.
Thank you. Marketing collateral.
Extra credit.
Alright, should be good.
Thank you. Y'all are great. Have a good night today.